Okay, so we're moving on to the third and final section of Lecture 16. We've talked a lot about teratogens and things that can harm the fetus without harming the mother. And now we're just going to talk about pregnancy in general, so a bit of a happier topic. So we've already talked about fertilization, implantation, embryogenesis, and fetal development. So we spent a lot of time talking about how that all occurs. So now we're going to be talking about what is being sensed by the person who is pregnant themselves and what is going on in their body. This is going to be a pretty brief and superficial overview of pregnancy. We could spend the entire semester talking about pregnancy. We're really just going to focus, for the purposes of this class, in on some of the main events that are important. So we divide pregnancy up into 3 trimesters. A trimester is a period of 3 months. So pregnancy is generally a 9-month process, or 40 weeks from the last menstrual period. So if you remember, if we use that menstrual timing instead of the fertilization calendar. So in those first 3 months, we've got fertilization, implantation, and embryogenesis, and just the very beginnings of fetal development happening. So it's very common in the first trimester that the pregnant person is going to start to have some nausea or vomiting, often called morning sickness because it's often worse in the morning, but in some people it can be all day and all night sickness, or some loss of appetite. Breast tenderness is also common during this time as levels of estrogen are starting to rise and starting to encourage that maturation of the breast tissue. So remember, when we did breast anatomy and physiology, we talked about how the breast tissue doesn't fully mature until someone is pregnant and gives birth. Another notable symptom that pregnant people experience in the first trimester is fatigue. People can feel really wiped out. And it's interesting, I was trying to find, pictures of pregnant people who were tired or nauseated, or, female body people who were tired or nauseated. And the only pictures I could find were of them doing like housework or being at home. It was really interesting. But anyhow, what's happening chemically in the person's body is that HCG is secreted at a very high level in the first trimester. So remember, that's human chorionic gonadotropin, or HCG, which is the hormone that turns a pregnancy test positive. So let's just remind ourselves that HCG was initially produced by the trophoblast, which was that outer shell, that outer circle of cells for the blastocyst. So when it implanted, remember, the trophoblast is going to go on to become the placenta. The inner cell mass is going to go on to become the embryo itself. So HCG tells the corpus luteum to keep making progesterone, right? It says, we've got one, don't stop making progesterone, don't let the endometrial lining shed, we don't want to have a period, we've got one here, right? So HCG tells the corpus luteum to keep going so that we maintain that endometrial lining. It's also going to tell the immune system to kind of back off a little bit and not attack the embryo, because this is a different organism, right? This is a foreign invader in many ways, so you need to tell the immune system to just kind of let it go. HCG also seems to be what is making the pregnant person feel really tired and nauseated, along with increasing estrogen levels. It's not doing that on purpose, it just seems to be a side effect. So I just want to let you know that later in the pregnancy, as the placenta, which was the trophoblast, right? So the trophoblast develops into the placenta. As it further matures, it's going to make its own progesterone. So it's going to stop making HCG, and the corpus luteum will degenerate later in the pregnancy once the placenta has been able to take over. All right, after the first trimester comes the second trimester, or weeks 13 through 27 by the menstrual calendar. And so, you have to love these picture series that people do when you can see that now the pregnancy is starting to become visible to an external observer, right? Another really exciting thing about the second trimester is that the fetus is getting big enough and it's also starting to move that usually fetal movement can be felt. Somewhere around 12 to 14 to 16 weeks, it depends on the person and on the pregnancy, the pregnant person can feel the fetus moving. In the beginning, it can feel like a little tiny fluttering. You can wonder, is that just some gas from the soda I drank earlier? It can be very difficult to tell, but then as the fetus gets larger, it becomes a little bit more clear-cut. So the woman begins to show, as I mentioned, you can externally observe that somebody is pregnant, right? The belly starts to kind of protrude. And weight gain is now going to start to occur. At this point, it's going to not be due to the growth of the embryo in the fetus so much, because at the end of the second trimester, the fetus is still maybe only 2 pounds, right? It's still very small. So it's mostly due to increase in breast tissue, because the breasts are going to continue to mature and develop. Those mammary glands are going to start to develop and get ready to mature and produce milk. We're also going to have increased size of the uterus, and then the amniotic fluid that fills the inside of the uterus, and that fluid has weight to it. So we're going to start to see some weight gain usually in the second trimester. The morning sickness usually resolves. So as I mentioned, once the placenta is more well established, you don't make HCG anymore because you don't need the corpus luteum anymore. And so when HCG levels fall, usually that's associated with improvement in the morning sickness. And second trimester for most pregnant people tends to be a pretty good time. The nausea and fatigue of the first trimester are over, and the baby hasn't yet gotten so large that it's causing symptoms just due to its physical size. So most people in the second trimester feel pretty good. At this point, the placenta is making its own estrogen and progesterone to maintain that endometrial lining on the inside of the uterus and develop and mature the breast tissue. And another thing that happens is because the mother is now meeting all of the breathing needs and the nutrition needs of the fetus, which is growing like crazy, the pregnant person's blood volume is actually going to start to increase. They're going to actually have more blood in their body because they need to get more delivery of nutrients and oxygen to the fetus. They're able of taking in more oxygen because they have more blood. And they're also going to have an increased caloric requirement. So this is when you're really starting to eat for two, right? You're building a baby. So that's going to take a lot more calories and nutrients. So what about the third trimester? So there's some really exciting things happening in the third trimester. One is that the placenta, in addition to the estrogen and progesterone, is also going to make two additional hormones. One is lactogen, which if you break that word down, it makes total sense. So gen we know comes from genesis, as in to create, and lacto refers to milk. So that's going to help ready the breasts for lactation, so further maturing and developing those mammary glands so that you're going to be able to breastfeed. The other hormone is relaxin, which does exactly what it sounds like it would do. So one of the things that relaxin is going to do is suppress uterine contraction. So as the fetus starts to get larger and puts pressure on those uterine walls, they're going to be tempted to start squeezing on that baby and start contracting. And relaxin is going to inhibit that and prevent that from happening. Because remember, it's too early still until we get close to the end of the third trimester. The other thing relaxin does is it starts to loosen some of the ligaments and joints. This will be really helpful for childbirth when some of those ligaments and joints need to stretch a little bit for the baby to get out of the pelvis. But it also can increase the woman's risk of certain types of musculoskeletal injuries like ankle sprains. So you've maybe heard people talk about like, oh, I'm not supposed to exercise because I'm pregnant. So first of all, that's not true. Exercising is healthy and good for everyone, including pregnant people. As long as you're not playing rugby or downhill skiing or doing something where you're likely to get smacked in the abdomen, right? As long as you're not going to get subject to trauma because of your exercise. Exercise is actually encouraged during pregnancy. It helps make you strong and fit. But We do tell people, especially as they get later into the pregnancy, that you want to be careful about anything that's going to put a lot of pressure on your ligaments and joints. So activities with a lot of cutting type motions where you're kind of like running one way and then you stop and run another way. So things like soccer or basketball, those types of things, your risk of twisting a knee or an ankle is going to be a lot higher later in the pregnancy. So we ask people to be really careful and kind of avoid those types of activities. In the third trimester, the woman's body is also going to start to retain more salt and fluid, and so she might get a little puffy, she might get some swelling in her ankles or her legs, and at this point, the total blood volume has increased by about half. So a typical female-bodied person will have a blood volume of about 5 liters total of blood in their body, but by the end of the third trimester, it's usually 7.5 liters of blood. So her body has not only been busy growing a baby, right, but also making a lot more blood. Now, what's happening with the fetus? Well, as you know, it's doing a lot of growth and maturation. And the problem here is there's just not a lot of room in humans. So what we can see here is here's a nearly full-term infant, right? Here's the placenta here. And then this little tiny space here is where all her intestines have been squished. Down here is the bladder, right? The urinary bladder, and the baby's head is pressing directly on it. And up here, squished up against the diaphragm, up against the chest cavity, is the stomach. So later in third trimester, you start to see some symptoms associated with the fact that the fetus is just getting really big. So it's kind of pushing on things. It can, make it, you have urinary frequency, right? You feel like you have to pee all the time because the baby's head is pressing on your bladder. Or you can get a lot of heartburn because your stomach is all squished. Or back pain too, because this is, the whole pregnancy itself, when you take into account the uterus and the amniotic sac with all its fluid and the baby, probably about a good 15 to 20 pounds that you now have kind of hanging off the front of your body. And so that alters your body mechanics, and so back pain can also be common near the end of the pregnancy. So a summary of some of the maternal changes. So on the left side, we have a graph showing months of pregnancy. And then we can see first, this curve right here is HCG. So as we talked about, it's really high in the first trimester, and then it comes down after that as the placenta is able to make its own hormones. The other hormones that we talked about are lactogen and relaxin, and they're not on this graph, but they basically follow the same trajectory as the estrogen and progesterone, right? So they kind of come up again late in the third trimester. We can also see on the right-hand side here that at the very beginning, the uterus is small and the embryo is tiny, right? By the end of the first trimester, the embryo is maybe an inch or two, right? Second trimester starts to become significant in size, and third trimester starts to become quite large. So in summary, we divide pregnancy into 3 trimesters. In the first trimester, high HCG levels secreted by the trophoblast and placenta cause nausea and fatigue in the part of the pregnant person, and this is the time of embryogenesis. Definitely a time when you don't want to consume a teratogen, right? Second trimester, we can start to feel fetal movement. The pregnancy begins to show. You can tell by looking at someone sometimes that they're pregnant. A lot of fetal growth and development, and the placenta is now making its own progesterone to maintain that uterine lining, as well as estrogen, which is helping to mature and develop the breast tissue. Then in the third trimester, further fetal growth and maturation, it gets quite big now and starts displacing the abdominal and pelvic organs and sometimes causing symptoms associated with that. And the placenta, in addition to making progesterone and estrogen, is also making lactogen to help prepare the mammary glands in the breast for producing milk, and relaxin, which keeps the uterus relaxed and also starts to loosen some of the ligaments and joints. So that's it for pregnancy. We'll pick up next week talking about the process of birth.